Now, how do you know if you have a pelvic floor disorder? I know that we have a graphic that's showing us some of these symptoms. Louise, but can you walk us through them?
So the pelvic floor muscles, which I treat, just like any muscle in your body, most of us have had back pain or neck pain or fatigue or weakness. That affects the function of the different systems that go through the pelvic floor. Okay. So some of the symptoms might be urinary issues, overactive bladder, or incontinence. You can also have retention, which we'll get to later as well. Right. Constipation and bowel strains, lower back pain, as I mentioned before. The pelvic floor is a really important part of our core, and when it's not working well, it leads to back pain. Pain in the genitals, the rectum, during sexual intercourse, pressure. When you have prolapse or the descent of those organs, often women will report they feel heaviness down in that.
Right, you feel like a pressure,
exactly.
Okay.
Or muscle spasm, which is common. We all recognize it from Charlie horses or pulled muscles elsewhere, but you can have it in the pelvic floor.
Let me ask you, Louise, is it common to have one of these symptoms, or do you experience a couple of these when you have a pelvic floor disorder?
You can have one or multiple. It depends on your situation and your problem.
No, so at what point then should a woman seek treatment or seek the advice of her doctor to see what kind, if you have a pelvic floor disorder?
So most women should have regular checkups, and at that time, if your doctor doesn't ask you, you should volunteer and say, hey, I have an issue with urinary frequency or urinary leakage, because that's the time for them to examine you and recommend different treatment options.
So then at what point are you diagnosed, and how is it diagnosed?
So any leakage is considered incontinence.
Okay.
So it's most of the time it happens to be when the woman decides she isn't going to put up with it anymore.
Right.
And it's not a normal part of aging that we leak urine.
Right.
So I encourage people
not to dismiss it as that.
Exactly.
Okay.